Hello and welcome. Today we'll take a detailed, science-backed look at testosterone, one of the most foundational hormones in bodybuilding. We'll cover what it is, what forms are used in sports pharmacology, how it works in the body, proper protocols for administration, expected results, and of course, risks and precautions. This video is designed for educational purposes and should not be taken as medical advice. Always consult with a healthcare provider before starting any hormone therapy. Testosterone is a naturally occurring androgenic anabolic steroid produced primarily in the testes and, to a lesser extent, in the adrenal glands. It plays a central role in muscle protein synthesis, fat metabolism, red blood cell production, and mood regulation. In men, optimal testosterone levels are associated with higher energy, muscle mass, strength, and libido. In bodybuilding, synthetic testosterone is used to elevate these levels beyond the natural baseline, which leads to enhanced hypertrophy and recovery. There are several esters of testosterone used in bodybuilding, each differing by half-life and release profile. Testosterone Enanthate, one of the most popular. Long-acting, injected twice per week. Testosterone Cypionate, very similar to Enanthate. Popular in the US testosterone propionate, short-acting, more frequent injections, more stable blood levels. Stanton 250, a blend of 4 testosterone esters with staggered release times. Testosterone undecanoate, extremely long half-life, used more in TRT than bodybuilding. Each has pros and cons depending on the goal, bulking, cutting, or maintenance. Once administered, testosterone increases the body's nitrogen retention, boosting muscle protein synthesis. It also inhibits catabolic hormones like cortisol. The result? Accelerated muscle repair and growth, increased strength, and improved workout endurance. Furthermore, testosterone enhances erythropoiesis, red blood cell production, which means better oxygen delivery to muscles. It also contributes to neuromuscular coordination, improving training efficiency. For bodybuilding purposes, the typical dose of testosterone ranges from 250 mg to 750 mg per week. Beginners often start at 300-500 mg week, usually with testosterone enanthate or cypionate due to their stable release. Cycle length is commonly 8 to 12 weeks, depending on goals, tolerance, and experience. More advanced users may go higher in dosage, but this significantly increases the risk of side effects. With proper training and nutrition, testosterone users can expect increased lean muscle mass, typically 4 to 7 kg over a full cycle, notable strength gains, improved recovery between sessions, more aggressive and intense workouts due to CNS stimulation. Decreased fat mass, especially with a calorie-controlled diet, results are typically seen within 2 to 3 weeks of administration. Exogenous testosterone suppresses natural production via negative feedback on the hypothalamic-pituitary-gonadal axis. Post-cycle therapy, PCT, is mandatory to restart endogenous testosterone production. Common agents include clomiphene citrate, Clomid, tamoxifen citrate, Nolvadex. Sometimes HCG during or after the cycle. Skipping PCT often leads to low libido, mood swings, and muscle loss. Testosterone use is not without risks. Potential side effects include gynecomastia, testosterone aromatizes to estrogen, managed by aromatase inhibitors like anastrozole, water retention, acne, hair loss in genetically predisposed men, elevated hematocrit, leading to potential cardiovascular strain, suppressed fertility, and, if abused long-term, risk of cardiovascular disease, liver strain, or psychological dependency. Monitoring blood work is essential during and after the cycle. In many countries, testosterone is a controlled substance, legally prescribed only for hypogonadism or TRT. Using testosterone for bodybuilding is often against anti-doping rules in competitive sports. Always know your local laws and competition rules before engaging in any hormonal enhancement. Ethically, use should be approached with informed consent and responsibility. In conclusion, testosterone is one of the most effective and well-researched anabolic agents available. It has the potential to significantly improve physique and performance, but only when used intelligently and responsibly. The key is understanding the science, respecting the risks, and not cutting corners with your health. If you're considering testosterone, educate yourself, speak with a professional, and never prioritize short-term gains over long-term well-being. Thank you for watching. If you found this video informative, consider subscribing to our channel and visiting our blog for more detailed articles on this topic.